Before initiating the blood pressure assessment, you want to make sure that your patient has not had caffeine or nicotine at least 30 minutes prior to assessment. Have the patient sit in a relaxed position for at least 5 minutes. Make sure they do not have any crossed limbs and their arm is at heart level. Instruct the patient to remain sitting with their feet flat on the floor. In order to obtain an accurate reading, it is best to place the blood pressure cuff on the bare arm. Align the cuff with the brachial artery. Make sure that the cuff is not on too tightly by inserting 2 fingers between the cuff and the patient's arm. Insert the earpieces of the stethoscope facing forward into your ears and place the diaphragm over the brachial artery. Tighten the valve on the pump and inflate the cuff to about 180 millimeters of mercury, or 20 millimeters over the first Korsakoff sound. Slowly release the air at 2 to 5 millimeters of mercury per second. The reading at which the needle is at when you hear the first sound will be the systolic pressure reading, and the last sound will be the diastolic pressure reading. Before measuring blood pressure again, wait at least 3 to 5 minutes. Make sure to classify the patient's blood pressure after measuring. A systolic blood pressure at 120 millimeters of mercury or less is considered normal. Between 121 and 139 prehypertensive, and 140 and above is hypertensive. A diastolic blood pressure at 80 millimeters of mercury or less is considered normal. Between 81 and 89 prehypertensive, and 90 and above is hypertensive.